I would like to just kind of define what infectious disease does.
When I first started out at a smaller community hospital, I was seeing pneumonia cases, complicated urinary tract infections, really bad diarrhea infections, C. diff, and then bacteremia. Here at a couple of my academic institutions I've been in, we definitely see a lot more, I guess, complex cases dealing with pathogens that, you don't really hear that much of. We see pre-transplant patients. So we go through their infectious disease history and see if they're up to date on vaccines or what their risks are after transplant. And then you can also see patients in the outpatient setting, HIV patients, travel medicine. So there's a lot of different settings that nurse practitioners and physician assistants can work in.
There are some specialties in medicine that I think PAs and NPs never even think about going into. And infectious disease is one of those. I'm talking with a PA today who has worked in infectious disease his whole career, and he absolutely loves it. He's also going to talk a little bit about what it was like working through COVID in infectious disease. So, if you want to peek inside this specialty that not a lot of people really talk about, then definitely stay tuned.
I'm Dustin Marley. I'm a physician assistant. I've only worked in infectious diseases, and I've worked in infectious diseases now for a little over 10 years. When I first started my journey, I worked in a private practice, and I was seeing patients at a small community hospital. So that was inpatient. And then 5 to 6 years after that, one of my physicians decided to start his own telemedicine company with an emphasis on infectious diseases. So I was also seeing patients via telemedicine and then helping out with some business aspects of it. And then COVID happened, and I was kind of running all over the place, wearing many different hats. And for the past couple of years, I've worked at a couple of different academic institutions.
Well, thank you for joining us. I'm excited to learn more about infectious disease. I think it's definitely one of those specialties that PAs and NPs don't really know much about or even think about going into. Travel medicine, something I never would have thought about, falls under the umbrella of infectious disease. And is that taking care of people who are getting ready to travel and like making sure that they have all the immunizations they think that they need, as well as when people come back with maybe unusual diseases that we don't normally have here in the States?
It's mostly geared towards those patients that are going to go travel or do some type of international travel and just make sure they're up to date on immunizations. They know their risk factors when they're going to a specific area and things of that nature. And I also apologize. I forgot to mention too that, again, it depends on the type of setting you work, but a lot of the physician assistants or nurse practitioners also handle something called OPAT, so outpatient antimicrobial therapy. So for instance, if patients are in the hospital and they have to get discharged home with IV antibiotics for a certain duration, usually a PA or an NP will kind of take over that, monitor their labs weekly, and then, get a follow-up appointment with those type of patients.
I'm curious, in infectious disease, because it's so specialized, do you see peds and adults, or is it usually divided just like the rest of the specialties are?
Yeah, that's a great question. I mean, for me, I only see adult patients, and
Okay.
I think it's just kind of split up like other specialties. So there are pediatric
Oh,
infectious
okay.
disease physicians. I don't think there's very many PA or NP jobs because there's so few of those type of physicians. So I think for the most part, a lot of us in the infectious disease area only work with adult patients.
And I'm always curious to ask people when I find out what specialty they work in. Was this on your radar at all when you were in PA school? I mean, had you thought about, oh, I'm going to work in infectious disease, that's what I want to do? Or how did that come about?
Yeah, I was always interested in infectious diseases. But when I was in PA school, I initially wanted to do surgery. So I took 3 months of surgery and I hated it. I was
Oh,
yelled at
no.
all the time. I had to wake up early. A lot of my surgical rotations were during the summer. So all my friends that had the better rotations were by the pool. And so I just was working nonstop and I just did not like the type of environment. And I just remember one of my surgical rotations was going to be in cardiothoracic surgery, fell through. And so I had to pick an elective, and it was with this infectious disease doctor in Delaware. And he was phenomenal. And you would get consulted on these very complex cases, and you'd have to think and use your brain. And I just ended up loving it. And that was close to when I was about to graduate. I had one more rotation left. And after that, I was kind of going to either go into internal medicine or see what else was out there. And I was just lucky that there was an infectious disease opportunity available. And here I am today.
That's so cool. And I I know people when I went to PA school who are like, no, I am definitely going to do orthosurgery or I'm definitely going to do dermatology or whatever. But I think it's so important that people go into their rotations with an open mind because I've heard talk to so many people that have fallen into something that they had no idea that they would love. And so it's very cool to hear that. When you're talking about the pediatric infectious disease and you don't see, there's not that many of them, so you don't see very many PAs and NPs really doing that. Just what about like in infectious disease in general, like for adults, have you come across many other PAs or NPs doing this?
I think it's gotten better. Unfortunately, there's not a lot of physicians going into this specialty. People aren't paid as much as they are in other specialties. So I definitely think there's a huge need for PAs and NPs to get in this field. And when I started out 10 years ago, I don't think there was very many of us. And now I think you see a lot more job postings. I think it's becoming more commonplace to kind of see people in this specialty. And I think, at the end of the day, I tell this to everybody who's applying to PA school or about to graduate. I said, if you really love something, if you really are passionate about a certain specialty, just go for it. You never know where it's going to go, and I mean, sometimes you change specialties or fields or whatnot, and that's okay. But I think people really appreciate a person that's really passionate about what they do, and I think it really shows in the type of care that you deliver to patients as well. And I really wish people would do an infectious disease rotation if it's available, because I think it's helpful, especially to get the basics of antibiotics under their belt, right?
Oh
Because I
yeah.
think there's a huge need to properly prescribe antibiotics. There's a huge need to understand antibiotics and all the different type of bacteria, especially now that we're dealing with a lot of resistant type of pathogens out there. I think it's so important.
Is it a nightmare dealing with antibiotics all the time or not so much?
It can be, but I mean, I think I've been in the specialty long enough to understand that there's still a huge need for other providers, physicians, PAs, NPs to learn the basics of antimicrobials. I'm not trying to be mean by any,
No, yeah.
on purpose, but I mean, there's a huge need. And so, sometimes I get consulted too late on patients that have been on inappropriate antibiotics or who don't even need antibiotics. And so, and I always tell people, consult us earlier than later, so we can help out, right? I think at the end of the day, we all want what's best for the patient. And so I get it. It's a huge uphill battle, especially depending on where you work, to kind of educate patients, providers on this stuff. But it's so important at the end of the day. I mean, if you look at all the statistics, it's scary. And I get text messages or emails about, oh, I have this bacteria that's resistant to everything. What do I do next? And it's like, well, this is what we've been warning people about for a number of years. So,
You actually are seeing that you work with patients that there's nothing that can be done with it because they're resistant to everything?
well, I want to say there's nothing. I mean, we still have, I guess, quote unquote, a couple of big gun antibiotics that we can use. But I mean, it's scary when you get down to only one or two antibiotics are available, and they're very expensive, and it's kind of a last shot. And so it's scary. So that's why we want this education to be out there in order to properly use antibiotics so we don't get to this point.
Speaking of scary, what about you as a person working in infectious disease? Do you have to suit up a lot of times or do you get worried about catching things?
It's not funny, but it reminds me when I first graduated, and there was an Ebola scare in the United States. And
Oh,
so, and, you would just get calls from the ER that you might have a patient who might have Ebola. And so, and it turns out it was a patient who was on a phone with somebody, wasn't even near them, who had Ebola. So it's like all these little possible scary things that you might encounter. But I mean, for the most part, there's tuberculosis that you have to wear a specialized mask for. I mean, there's very drug resistant infections that you have to wear gowns and gloves. So yeah, I've definitely come across those. But I say this to patients and everybody. I think the most important thing in order to not contract anything is to always wash your hands with soap and water, or the alcohol sanitizer if that's available too.
yeah, but it's not like every patient normally, right?
Normally not. I mean, the only caveat was during COVID, we would always wear gowns and gloves and masks and goggles and whatnot. So yeah, I mean, it's definitely possible, but no, it's not every patient.
So that must have been kind of crazy to work in an infectious disease during COVID. You want to talk a little bit about that time and what it was like?
It was very challenging. in some ways, it was terrible. I mean, you're dealing with a new virus that's causing widespread destruction, and you don't know much about the virus or what we can do to help combat it. And, a lot of patients are dying from it. And I think as healthcare providers, in some places, you didn't have the best resources to do your job properly. So, I mean, it was
Mm.
a very frustrating and challenging time. And I think you just have to do the best you can with the resources you have.
And I think COVID has opened people's eyes to the fact that anything can come down the road. And I know there's several things that people are watching around the world. Do you think about that a lot? Do you have to stay up on all these things that are developing around the world?
Yeah, I mean, I think it's something to always keep an eye on, right? I don't think we intentionally are trying to scare people saying, "Oh, we see an outbreak of this or whatnot." I'll say this, and I've told everybody this too. Infectious diseases is an art in some ways. It's a different way of thinking. And so when COVID happened and you get other outbreaks, I mean, you watch it closely and see how this virus or pathogen behaves, and then you kind of, have to take the necessary steps from that. And so sure, there's outbreaks that we're concerned about, but you kind of just have to use your background and knowledge and say, okay, well, this is at risk for these people. Right now it's not concerning for the general public to be freaked out just yet. So, I mean, it's always going to be part of the job per se to keep an eye on what's going on in the world, but we try not to cause any unnecessary panic.
Again, referencing House and how infectious disease is portrayed in parody and in movies. How much of it is like that in real life?
It depends. I mean, again, I think it's an art form, right? So if you're dealing with, kind of those quote unquote bread and butter cases where you have a urinary tract infection and, bacteria that's in the bloodstream, those two are mostly linked. But if you have a case that doesn't make sense, I think you get 90% of your answers from a very thorough history and physical. So yeah, compared to other specialties, we spend a lot of time, questioning and interviewing patients on what their exposures are, when this kind of started. And that way we can kind of put the pieces of this puzzle together and kind of figure out what's going on. So it just kind of depends on what the case is, but it's very important in our specialty.
Okay, so let's talk a little bit about like what your day looks like. So right now, you said you work for an academic center. So are you like inpatient mostly or outpatient? What are you doing right now?
Yeah, so mostly inpatient. And so, meaning that I'll see patients in the hospital. And then on Thursday afternoons, I have a half day outpatient clinic, meaning I'll see patients in the office. And those are mostly follow ups from the hospital, just to kind of checking on them and seeing how they're doing. So my day usually consists of rounding on patients that I've been assigned. Right now, I'm seeing mostly transplant patients, those that have infectious disease problems. And then other patients I'm seeing are those that have surgical complications. So those are kind of the two main patient populations I'm seeing. And then usually we'll go round on them on my own. And then whoever the supervising or my attending physician is throughout that day, I'll usually just touch base with them later on or earlier, depending on, how important it is.
So you have a fair amount of autonomy then? Like, are you often the one trying to get to the bottom of what's going on?
Yeah, again, I think it depends on what type of setting you're in and who your attendings are and how comfortable they are with you. When I was first starting out in private practice, I mainly worked with two physicians, and I don't know if people like the term physician extender anymore, but when I was with these physicians for so long, I kind of knew how they would how they thought and
Mhm.
would do things. And so literally was kind of an extension of them. So they, after a while, felt comfortable me just kind of doing my own thing and seeing patients and then touching base with them. And I think when you're newer at an institution, they kind of, want to make sure that you know what you're doing and then kind of, what the culture is of the institution and whatnot. So sometimes I'll have to touch or communicate more with those attendings, more so than if I was in private practice. So it just kind of depends on the type of setting you're in.
I wonder about procedures.
So in infectious diseases, there's no procedures that we do. I think a long time ago, you could do your own lumbar punctures and
Yeah.
maybe INDs or incision drainages, but yeah, nowadays it's not no procedures.
So very cerebral specialty, a lot of thinking through things and being a
Yeah.
detective kind of. What are the things that you think are the best positives about working in infectious disease?
I am constantly thinking as it is. I'm definitely an overthinker. And so I think just having a specialty where I'm constantly thinking about something, I really appreciate. And plus, if you get these very complex cases, you kind of feel like a detective trying to figure out what's going on with this patient. So, I mean, it's just exciting. And usually with infectious diseases, patients get better too. So, not
Mhm.
only are you have a complex case, but with the right treatment, they usually get better.
Yeah, you get that satisfaction. What do you think are some of the challenges or downsides, especially?
I think when you're in private practice, because we don't do procedures, a lot of our reimbursement comes from seeing a lot more patients. So I think it can be very heavy volume wise. So I think that's kind of the one of the main things that people don't like. And again, I think, I've trained and I've hired PAs or NPs in the specialty. And I think it comes down to if you really enjoy the specialty. Because I think,
Yeah.
if you're not too excited about it, if you don't enjoy what you're doing, I think it kind of shows, and I think people kind of get burnt out with it and move on after a year or two.
And I would imagine the charting is pretty in depth.
Yeah, that's a great point, especially when you are dealing with transplant patients that, have a new organ or a stem cell transplant. I mean, they can be the sickest of the sick. So yeah, the charting can get very extensive. So that's a great point you brought up.
Can you give us an idea of like how many patients you're seeing?
If you're in a community hospital, usually the infections aren't as complicated or severe. So sometimes you'll see 20 to 30 patients. And I think if you're at an academic institution, it's usually a lot lower than that just because they're so complicated and you don't really get consulted on the, again, bread and butter type of cases.
And then when you're in the inpatient setting and you've been called in, and once you decide what the treatment is, then are you still following them, or do you just get the treatment started and then it kind of reverts back to the hospitalist following them?
When you're dealing with very sick and complex patients, this can also be up to your discretion too. Usually, you want to see them every day. Ones that are, say they have like a complicated urinary tract infection, they're improving. You can usually kind of, I guess, quote unquote, follow them peripherally, meaning just be on the sidelines, do a chart check, maybe see them every other day. So it just kind of depends on the type of patient.
Yeah. Talking about PAs and NPs, I wonder what you're kind of seeing out there. Does it seem to be kind of an even split between PAs and NPs in infectious disease?
I think for the most part, it might be evenly split, but I think it honestly depends on the type of state you're in, where you
Yeah.
work. So I think both are great for this. We can train whomever that's interested in it to be successful in their job.
What kind of personalities do you think do well in this specialty?
I think people that are self-motivated, people that are excited about infectious diseases and learning about it. I really like microbiology. And so just learning about all the different types of bugs, fungi, viruses was very exciting for me. And then how that correlated or interacted with the certain antibiotics, antivirals, the treatment. And again, I really like the detective aspect of it. So I think just having that type of curious mindset, people do really well in this position.
And I would think maybe detail oriented. Is that fair to say? Do you have to really be able to hone in on details?
Yeah, I mean, especially, I think when people read my notes, they know I'm very detail oriented, which can also be a weakness. You get bogged down in the details. But yeah, I mean, it's very important. Again, if you're taking care
Yeah.
of complex patients and you're keeping track of all these labs and cultures and everything that have been sent out or that have been ordered, that definitely helps as well.
So I wanted to get back a little bit to the schedule. Are there any infectious disease inpatient PAs and NPs that you know of that work rotating schedules like hospitalists do, like 7 on, 7 off, or that are there overnight and on weekends and holidays? Or do you see it mostly as being like a Monday through Friday daytime inpatient job?
I think for the most part, it's definitely a Monday through Friday, like 9 to 5 type of job. And then usually, depending on where you work, they want some weekend coverage, maybe 1 week in a month at the very least. One of the institutions I just came from, they started a schedule where you'd be 5 days on, the weekend off, and then you'd be on for a whole week and then have the following week off. But I mean, I think that's very rare. I think it's a very Monday through Friday type of job. The nice thing though is there's no call, so I don't have to answer any phone calls after hours.
Can you give people an idea of either like a salary range or how you would compare the salary in this specialty to maybe family practice?
Depends on, if you're in private practice or academics. And it depends too on what your contract shows. So when I first started at a private practice, I had a base salary that was pretty low. I think this was 10 years ago, but it was 80,000. And then there was a productivity added on to that, depending on how many patients I saw. That included weekend coverage. And so I think I was around 120,000 at that time. So I think if you're a new grad, I think it's not unreasonable to try to ask for at least 110,000 at least for base salary, and then maybe add on, some other components to it like weekend coverage.
Is that common to be paid with RVUs?
I think when you're in private practice, it's probably more common. I don't think in academic institutions it really matters.
Yeah.
So they usually just have kind of a lump sum type of salary.
How does it differ working in a big academic institution for infectious disease versus someplace else that you've worked before?
You usually, again, don't have to see as many patients, which can be nice, but usually the patients you do see are a lot more complex. So it requires a lot more thinking, a lot more legwork. And I think you don't have as much autonomy, which can be good or bad. There's a lot more, I think, collaborative effort. You have a lot more teams on board on certain patients. We definitely have case conferences where we go over certain cases and patients. The nice thing, though, is usually you have more diagnostic tools at your hand that are a lot more innovative. And so it makes my job so much easier if I have a robust microbiology lab that's able to identify certain pathogens a lot more rapidly than like at a smaller place where it takes a while to send stuff out.
If people are interested in this, like say they're already a PA or an NP working in family practice or something, and they're interested in getting into infectious disease, any guidance that you would give them, any ideas of how to prepare to work in this specialty?
Connecting, networking is huge. So I'm pretty active on LinkedIn. I think just reaching out to people in the specialty and just say, hey, I'm looking to get into this. Are there any openings? Keep an eye on any job postings out there. I think there's a lot of good resources out there. There's the Infectious Diseases Society of America or the IDSA website that has a lot of guidelines on how to treat certain infections. There's up to dates. There's a lot of antibiotic reviews that you could go over to learn about the different antibiotics and what they cover. And then I also think it's important too to sign up for health alerts. So each state kind of has a health alert system. And so I would definitely sign up for that because you get alerts on, what's going on in your state. You can kind of track the different viruses that are going on, especially in the winter to see how severe it is. So you can go to like each state's health department. So they might have something to sign up there, or the CDC has each state listed where you can kind of sign up for email alerts that way as well. So
Do you think that this is a specialty that's really ripe for growth for PAs and NPs?
Oh, 100%. Like I was saying, I think a lot of physicians aren't going into the specialty. And so I think, especially private practices, I think just to have a PA or NP on board would be a huge help.
And do you think that this is a specialty that is good for new grads to go into?
I think it's great for new grads to get into. I think some places prefer new grads. That way they can kind of train them how they want to be trained and get them up and running that way. I think some areas want a little bit more experience. Again, it just kind of depends on where you work. But I think it's a huge opportunity for new grads to break into if they're interested.
Anything else that you want to say about the specialty or a plug why people should consider working in infectious disease?
I mean, I love infectious disease. I think at the end of the day, if you are really passionate about something, even if it's not infectious diseases, to definitely pursue it because you really don't know, where it can lead to.
Great. Well, thank you so much. I really appreciate you sharing with us
Yeah.
today.
Thanks for having me.
Check out this playlist here where I interview PAs and NPs working in all the various medical specialties. Thanks for joining me. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.